Hi, my name is Krista Buford, and my behaviorist is Dr. Joseph Lalli, who unfortunately passed away in 2001. He was born in Philadelphia. He graduated from high school in 1970, and then from college with his bachelor's degree in 1977, with his master's degree in 1985, and then finally with his doctorate in 1990, when he then went to work for the University of Pennsylvania at their School of Medicine. Additionally, he was also the director of the biobehavior unit of Children's Seashore House, and he worked at the Seashore House until he passed away in 2001, but he worked at the University of Pennsylvania until 1999, when he then went to work for Holy Family College. The Children's Seashore House, I wasn't sure what this was, so I looked it up, and it is where individuals with mental and behavioral issues go. It's specifically for children, and it's across the board for disabilities. You don't have to have a specific disability to go there. It's also not just behaviorists that work there. There are also psychologists and psychiatrists who work there to help individuals and their families handle problem behaviors. He served as the director, as I mentioned prior, and most of his studies that he conducted were done at the Children's Seashore House. So most of the articles that I read for this assignment were conducted on clients at the Seashore House. He was an author. He published over 100 articles in JABA and other prominent journals. He served 2 terms on JABA Board of Editors and as associate editor, and his studies covered a range of topics such as how behavioral processes maintain problem behaviors, the effects of various methods on reducing escape behaviors, how to teach individuals with disabilities necessary life skills. Skills such as tying your shoes, making a sandwich, any kind of skills that somebody with disabilities would need more practice to learn how to do. In Remembrance was an article written about his life. So this one wasn't written by him, it was written about him after his passing. He was well respected in the behavior analysis community, and everyone who knew him loved him. All of his colleagues just knew he would have done greater things had he lived longer. The first article that I read is Teacher Use of Descriptive Analysis Data to Implement Interventions to Decrease Students' Problem Behaviors. So in this study, it was using the descriptive analysis, which is where an observer comes in and observes the classroom and the natural environment and the client and sees what triggers the problem behavior and what is maintaining that problem behavior. In this study, they used extinction and replaced the problem behaviors with an alternative behavior. The use of the descriptive analysis showed the teacher how they were reinforcing the problem behavior. So you can see in the chart on the right-hand side the operational definitions for the descriptive analysis. So this is the actual analysis used in this particular paper, and it showed that the student gained access to a preferred item following the problem behavior, which is what was maintaining that behavior. Treatment of escape maintained aberrant behavior with escape extinction and predictable routines. This study focused on the use of schedules to prevent aberrant behavior that led ultimately to extinction. So in this particular study, it was conducted with 2 18-year-old males, and they tried doing both the picture schedule and the printed schedule and found that both of them decreased the aberrant behavior, but the printed schedule was much more effective. The working hypothesis was because it was more age appropriate, but that theory was never tested. So we're not sure exactly why they responded better to the printed schedule. In this study, prior to implementing the use of the schedule, the students were familiarized with the picture schedule and the printed schedule to be able to match each item to the activity to make sure that the students understood what it was they were going to be expected to do. And then they implemented the use of the schedule and the behaviors were decreased. Reducing escape behavior and increasing task completion with functional communication training, extinction, and response. This focused on using functional communication training to decrease unwanted behavior. So instead of a student acting out or throwing the materials to escape from a task, they would have to request the escape, whether it was through handing a picture card or making a sign or a certain verbal cue. That was how they escaped the task. Furthermore, in the beginning, they were allowed to escape the task as soon as they asked. However, as the trial continued, they would have to complete more steps before they were allowed to escape. I chose the meme trying to determine a mode of communication of a cat with a Rubik's Cube. I thought it was amusing because sometimes figuring out the best type of communication for our students can be difficult. Assessments of stimulus generation gradients in the treatment of self-injurious behavior. This one sounds a lot more complicated than it is. This is basically just saying that the closer the adult was to the child, the more likely she was to exhibit self-injurious behaviors. And the farther away the adult was, the less likely the individual was going to participate in self-injurious behaviors. And this one specifically, the student would hit herself in the face with her own fist. So she was having to wear a helmet, and she was admitted to the hospital, which is why the study began in the first place. So in this, if the adult was close to the child without touching the child, she was more likely to engage in self-injurious behaviors. However, if the adult left the room or was further, even just further away, she was less likely to engage in those behaviors. SIB can take many forms. It can be hitting, scratching, inserting objects like a pencil into your nose or ears, biting, hair pulling, head banging, cutting. And all these are behaviors that we have to be careful with as far as how we treat them, because it is important that we treat them and we help reduce, if not lead them completely to extinction. Competition between positive and negative reinforcement in the treatment of escape behavior. Our teacher was actually an author on this article, as well as Dr. Lalli. Positive reinforcers that were used in the study were edibles, and the negative reinforcers that were used were breaks. The outcome for this specific study was that positive reinforcers yielded better results. So I chose the meme, what if I told you positive reinforcement works better than negative reinforcement? This isn't always true. That isn't a generic fact. So you can't rule out the possibility of using negative reinforcement. Just for this particular study, positive reinforcement of edibles was much more effective than the negative reinforcers of breaks. Oh, the other note on this page is if it does not increase the behavior, it is not a reinforcer. Just like if it doesn't decrease the behavior, it's not a punisher. It's the response that's the most important part. My mock interview, I focused a lot on his studies and what he found most interesting and what he would have continued to study had he still been alive. So like I mentioned at the beginning of this article, he died at a young age. And my question to him would be, what would he have wanted to study or continue to study had he continued to live? I also was curious if his family had a hard time being around him. I find myself, even early on in the stages of studying behavior, that I have begun studying the behavior of those around me and trying to see what environmental causes affect their behavior. So I wonder if, at his point, with so much schooling and so much experience, if his family and friends, especially his children, had a hard time being around him. So those were the questions I would have asked. I also asked about the self-injurious behavior, or would have wanted to ask about the self-injurious behavior. As a teacher, it's hard for me to not intervene when those situations are happening. So, for example, during the gradient generalization, was it hard to continue the trials and continuously watch the client participate in those behaviors? Importance of Dr. Lalli's works, he published over 100 articles, and not only did he make a difference in our lives as far as being able to study the methods and strategies that he used, it also has made a difference in the actual client's lives. He's reduced the behavior in several people and has changed the lives of everyone he has worked with. These are my references, and that's all about Dr. Joseph Lalli. I hope you guys enjoyed.